ELI5. What do pharmacists do anyway? Every time I go to the pharmacy, I see a lineup of people behind the counter doing something. I'm sure they're counting up pills, but do they do anything else? In the UK, at least, the pharmacist is the final and primary person legally responsible for making sure that the prescription you're given won't do you any harm, for example by reacting badly with other things you're taking, by being the wrong dosage, by being unsuitable for other conditions you might have, and so on. That's why, even with over-the-counter medication, you'll often be asked whether you've taken it before, and similar things. In the past they would also have been heavily involved in actually making up suitable dosage pills, powders and so forth from the active ingredients. I would also like to point out that pharmacists can also have what are called collaborative practice agreements with providers, often involving a common type of patient, which allows the pharmacist to borrow their authority in a way. This is often limited but can allow us to essentially take over the practitioner's role in certain uncomplicated disease states. Most often I see it used for diabetes and warfarin clinics, for pharmacists to be allowed to order labs and prescribe the necessary medicine or dosages without a doctor's involvement unless needed. When I travel to South America, the majority of medications you can get via the pharmacist without a prescription. Doctors would prescribe the more serious addictive psych meds, but anything from blood pressure meds, antifungal, antibiotics etc. you can be under the care of a pharmacist. I feel this is something we should adopt here to take some pressure off docs. No need to get a prescription for a light dose blood pressure med or antifungal med and work your way up from a doctor. A pharmacist is more than capable of taking that on. Board certified oncology pharmacist here. As a clinical pharmacist, I review patients with my providers, discuss treatment options for various malignancies, build treatment plans, teach patients prior to them receiving treatment, manage chemotherapy-induced nausea and vomiting, electrolyte abnormalities, and run an anticoagulation clinic for those with benign heme conditions. I also help train physician assistant and pharmacy residents. My oncologists heavily rely on my drug knowledge and I have a lot of input on treatment trajectory. They verify that the medication you are receiving is indeed the correct one, pill by pill usually, verify that medications you take are safe to be taken together, sometimes change medications to an equivalent one in case the prescribed one isn't available. They also verify that the dosage is appropriate for you and so much more. They need to know most info about medications by memory. Our pharmacists knew if a patient could take a medication based off lab results, illnesses, for how long, etc. Thankful for the pharmacist at my local pharmacy that caught that was getting 2 of the same type of medicine for my mom. I think the doctor had changed it up but was still getting both of them and let me know when was going for a refill. They are much more knowledgeable on medicine versus what a doctor knows based on their schooling for it, whereas doctors will prescribe what the drug companies try to push with their marketing from their salesmen. I don't work in a classic pharmacy, but I am a pharmacist. Essentially I make sure doctors and nurses are treating infectious diseases in an appropriate manner to make sure we don't have another pandemic on our hands from drug-resistant bacteria. It's called antimicrobial stewardship. In 10-15 years I expect most people will know about it. By 2050 resistant infections are expected to kill more people than cancer. Pharmacists here, we make sure the medications you are prescribed are safe for you to take. What they are doing behind the counter is making sure your med history is safe. Without a pharmacist the amount of med errors increases exponential amounts. Aside from retail stores, pharmacists are found at poison control, in hospitals, in research and many other areas. It's a fun career. If you go to a compounding pharmacy like I do, they're kind of making your medication in-house. Not from scratch, but in the same way a bartender is making you a drink, but they're not distilling the alcohol. They take base ingredients, mix them and encapsulate them, or dilute them into solution in the correct mixtures to make your medication tailored for you specifically. They are counseling patients on the phone, submitting and dealing with insurance on behalf of patients, talking to doctors' offices to discuss drug interactions, dosing, etc. and verifying prescriptions. Is it the correct drug, proper strength, accurate pill count, does the label have the required information, etc. Source: wife is pharmacist. Pharmacists count pills? Hilarious! That's a pharmacy tech's job. The pharmacist finds every way to not answer the phone or talk to anybody. They read the order entry person's dosage instructions and will send it back to them to add one letter, even though they could easily add the letter themselves and be done with it. They make sure you get the right pills. Also, when the GP makes a mistake, they will try to call him to be sure you get the right medication and amount. There is a reason the 2 practices are separate. Pharmacists know more about medications itself, while doctors know more about which symptoms match which diseases. You can have multiple doctors who prescribe you various medications. The pharmacist's job is to review your medications to ensure they don't kill you when taken together. Don't be fooled by the fact that they work in a grocery store. They're legit doctors making bank. Their specialty is drug interactions. I had a new blood pressure med prescribed. Went to the pharmacy to get it filled. The pharmacist asked me if I was still taking the old one. Sure I was. Well, the two in combination might kill me. Certainly the doctor told me to discontinue the old one. No, he did not. I'm a big fan of pharmacists. In my hospice pharmacy, we work to make sure pain and symptoms are managed well for a lot of non-communicative and dementia patients, and to make sure family members with possible drug addictions can't get access to the patient's meds and patients themselves don't have enough supply to overdose too. At my pharmacy, they do paperwork. Wrong. Every other month we go to refill a monthly script and they say no, you had a 3-month supply. It's right here in our notes. Then have to bring the bottle and receipt to show them no, you filled a 1 month. Then it takes days for THWM to fix it. I'm from Poland and honestly, no clue. No one ever asks about other drugs and possible interactions. Dosage is pre-written by doctors, so they only write it again on the package. I know they can also make drugs unavailable on the market, according to doctor's orders, but it's a rarity. Those actually counting the pills and at the register are likely pharmacy technicians, at least in the US. As others mentioned, the pharmacist is the final authority. They make sure the script is written and filled correctly, and that the meds are safe for the patient to take. My pharmacist yells at my insurance company so I don't have to. It's insane that we have this additional for-profit step in the process, whose only job is to deny payment for some drugs that your doctor says you need. Either I pay for my drugs out of pocket, or I don't. I know that in some they might have to make their own pills. Like if a patient has an extremely high low dosage. I know they had to make my pills at the pharmacy when I broke my shoulder as a kid because I needed heavy painkillers but not that heavy. Oh, boy, here we go. They are medicine experts and know much about medicines and their potential side effects and interactions. They're supposed to check the prescriptions in order to catch said interactions and side effects should they be harmful. There is a number of drugs and ointments where parts of, or even the whole preparation and mixing process takes place on site. Especially for ointments, but also for stuff like antibiotics, etc. Source: just sitting next to a pharmacist friend ATM. There's also nuclear pharmacists. We make and dispense radioactive drugs for imaging and treatment. You likely will never see one of us, but we are always behind the scenes working to make sure your imaging provides the best quality information. Pharmacists are, in general, there for their accountability. The buck stops there for anything pharmacy related, similar to an attending physician at a hospital. You might have not screwed up, but you signed off on someone below you who did. I don't understand why they count the pills at the pharmacy in the USA. In Norway, we get them pre-packaged. The pharmacists are there to complete the pickup, help customers with information and things they don't know. There's also pharmacists for compounding. Basically they need to make sure that the drug that's being compounded is the correct drug and dosage so as not to harm the patient it's going to. The wording of your title is off-putting. What do they do anyway? Maybe be a little more respectful when asking questions about something you obviously don't know anything about. I honestly feel like it's one of those jobs a robot could do. I really don't want a pharmacist's input in my prescriptions in the first place. Just do what the doctor prescribed. They are largely obsolete. The computer informs of the interactions. Anyone can count. Admin staff can call insurance companies. Drug counseling they provide is important though. They make sure that the pills you're given are not going to kill you, for the most part. But they also prepare the pills and do other medical things to ease pressure on the GPs. I'm certain they take the prescription behind the counter, set a timer for 15 minutes and enjoy their lunch really slowly with a smart arse grin on their face. Like 95 certain. They take pills from a big bottle and put them in a little bottle. Then they get a small piece of paper with your name on it and stick it on the little bottle. The people behind the counter counting pills probably aren't pharmacists. My soul does it and they are just preparing for deliveries to nursing homes, etc. At some large chains, they make you wait 20 minutes so you might buy other stuff. Store chain policy. I have a friend who is a pharmacist. Pharmacists also make compound solutions and can mix meds. I'm not sure the technical terms, but a close friend is a pharmacist. They locked me up in the back until I finished packaging all the prescriptions tailored for every patient. They are trained to read bad handwriting and remember the spelling of hard to pronounce and long names.